Good afternoon, and welcome to Gun Violence in Missouri Seeking Solutions, presented by the Kansas City Star in partnership with American Public Square at Jewel. My name is Denisha Snell, and I'm the Program Director for American Public Square at Jewel. In the past few months, the Kansas City Star reporters have interviewed citizens, activists, faith leaders, and survivors of gun violence as part of their Missouri Gun Violence Project. This project was undertaken in partnership with the nonprofits Report for America and Missouri Foundation for Health. Today, we've assembled a group of panelists who are dedicated to eradicating gun violence in our communities, passionate about reframing violence as a public health issue and policy reform. The goal of today's event is to engage community members and work together to develop long-term solutions to reducing violent crime. We will have a civil, fact-based discussion exploring how we can move Missouri forward. As part of American Public Square and Kansas City Star programming, we welcome questions and fact checks from the audience. Please comment on the live stream with your questions or requested fact checks. Ian Cummings, editor at the Kansas City Star, will serve as today's fact checker. You can also find a fact sheet to support today's conversation on our website, americanpublicsquare.org. With that, I will turn it over to our moderator, Andreas Dominguez, Senior Program Officer at the Health Forward Foundation. Andreas?
Thank you, Denisha. It's a pleasure to be here this afternoon. At the Health Forward Foundation, we fight for enduring change that will elevate the overall health of the population we serve. We address the most widespread needs of communities, driving change in creative ways to help as many people as possible. Knowing that violence affects the overall health of a community, we are grateful to have the opportunity to participate in this program like this one. Gun violence in Missouri has been described as a public health crisis that has been devastating our communities with consequences across the state. In Missouri, as elsewhere across the country, government leaders have for decades tried treating gun violence as a crime problem to be solved with law enforcement. But despite hundreds of millions of dollars spent every year on law enforcement, budgets, and prisons, the problem is worse than ever. Missouri recorded its highest levels of gun violence in history in 2020. Instead, experts say the state should look at gun violence as a public health problem to be solved by investing in improvements in underlying life conditions that put people at greater risk or lesser risk: income, housing, food security, schools, and living environments. What researchers today call the social determinants of health. It's basically the things that make us who we are and who we are as a community. Now, to begin our discussion today, I'd like to introduce our panelists. Please welcome Jackson County Legislator Jalen Anderson. Jalen was elected in 2018 to serve a 4-year term as Jackson County Legislator for the 1st District at large, representing all of Jackson County. Before running for office, Jalen worked in foundation and nonprofit organizations focusing on economic development and anti-poverty programs. We also have Michael Whittier. Michael is a strategist with a focus on justice and health equity. In his professional roles, Michael adds and aids the advancement of health equity solutions and that are important in addressing health disparities in the St. Louis region. He received his master's in healthcare administration from the University of Missouri and is currently a doctoral candidate in business administration at Liberty University. And Michael, as y'all can tell, is at an airport, and so we hope he's going to be able to stay with us through the whole program. And next, we also have Dr. Marvia Jones. Dr. Marvia Jones serves as a violence prevention and policy manager within the City of Kansas City Health Department. As a community behavioral psychologist and public health professional, she is passionate about supporting behavioral health and resiliency among individuals and communities. Welcome, Dr. Jones. And our fourth panelist, Arletha Bland Manlove. Arletha is a Kansas City area resident who lost a nephew to gun violence in 2020. Welcome. So to begin our segment, I'd like to thank you again for joining us today. Let's get started by first focusing on violence and the social determinants of health. And Arlita, I'm going to put you on the spot first. Let's start with talking briefly about a comment in the Kansas City Star article that stated that your nephew's murder is a result of a system that undervalued his life and of government leadership's failure to protect it. Please tell us more about what that means to you and your family.
Well, for us, we felt like when we found out the accusers, some information about his background, this was a young man that had got into, I guess, the system at 16 by shooting someone over an Xbox. This young man was still on parole, very close to the end of his parole, and on house arrest. He had violated his parole at some point, and so we feel like the system failed us because when he made that violation, however minor someone may have seen it, that in itself was an indication that young man had not had enough resources to redirect his way of thinking, to give him maybe even skill sets to cope with anger and managing emotions, even resources to educate himself so that he could think differently and understand things differently. So that's where I feel like the system failed us and undervalued Matthew's life and the lives of the community. When you have young people who make these mistakes, and oftentimes they're mistakes of just inappropriateness. They don't understand, they don't know, they don't value whatever. But when we have them in these situations, it is our leadership's duty to not just house them or incarcerate them or put them on house arrest, but to give them the resources to make better decisions, to give them the resources to not continue to be in the system and to put themselves back in the system by their behavior, which already put them there. So we really feel like this murder of an unarmed man, my nephew was unarmed and he was ambushed and it was all caught on camera. And this young man just didn't use anything that indicates that he was thinking better of himself, of society, of his role in society. And I think that that's a failure of how we treat people who are incarcerated, as well as members of society, but certainly those who are already on papers or incarcerated.
Thank you. Thank you. Your comments are powerful considering how this has affected your family. So Michael, I want to go to you because Arlita just spoke to what in my opinion is a very passionate perspective about a system that has failed this young man. She's not coming from a vengeance or retaliation approach. Can you speak to us more about your work in health equity? Can you talk about the systems that have historically failed to protect the most vulnerable communities in our state, and speaking specifically about vulnerability as it relates to oftentimes young men of color?
Certainly, and it's just such a burden that we carry as a community, seeing these issues play out in our lives. I don't think anyone is immune to it. Similar to that story that was shared, there are countless stories that family members throughout the state have experienced. And so because of that, it has allowed me to really work in a place where we are trying to transform systems to improve access to care for people. And when I say care, we are talking about those social determinants of health. These systems have historically been problematic. We have seen the decreased funding of human services, health services throughout the state, which has been problematic, which has caused for policy reform in multiple areas. This is why Medicaid expansion was so important. We see so many issues intersecting with gun violence, and we need to address it. And it will not come in the form of a traditional public safety law or policy. It will come in the form of properly funding departments that could respond and even put in place preventative measures to support people. And I think COVID has shown us that our state health department, our state human services, all the way down to the local areas cannot handle crisis. And we are at crisis levels. We have been for quite some time. We have seen suicide rates in rural communities increase due to guns. We've seen homicide rates increase, and it's alarming. It's problematic. And until we come to a pragmatic solution that we can really center people, this is going to continue to be a problem.
So, Dr. Jones, I'm going to go to you next. You heard when Michael referenced the system, the problems within the system, the lack of funding, and trying to get into a pragmatic approach or a pragmatic solution. Can you define exactly what it means to frame violence as a public health issue?
Thank you, Andreas. So when we talk about violence as a public issue, what we're saying is that there are specific and measurable factors that we know contribute to a health outcome. In this case, violence. So whether we're talking about shootings, or we're talking about child abuse or domestic violence or suicide, what we mean when we say we should frame it as not just criminal justice or a social ill issue, but as a public health issue, is understanding that there are root causes, many of which Ms. Bland-Manlove has articulated so well. And I just admire her ability to come from the trauma that she is enduring, and still to be able to have that clarity of mind and understanding about these risk factors. And so it's looking at what are the risk and protective factors that we know would either hinder or advance this efforts to address this health issue.
So I'm going to go back to you again, Michael. Speaking specifically to the social determinants, how does that actually influence community violence in our state?
It's not just unique to our state, but I want to just be clear on some of how the outcomes are really playing out. When we look at social determinants of health, the foundation to those from the University of Wisconsin's Public Health Institute model is programs and policies. But when you look at the health factors that contribute or at least are guided by those programs and policies, what we see is about 20% of that being clinical health outcomes and access, but the other 80% social economic factors, health behaviors, structural components within the environment that community exists. What we see is a ripe opportunity for crime to happen. And so we see just education numbers at just bottom of the statistics. Missouri exists on the bottom half of education statistics. Same thing with economic opportunities, unemployment, social interactions, but then the health behaviors, sexual activity, sexual exploitation. We see drug use, alcohol use, which is one that gets missed over so much. And so all of these factors contribute to one's quality of life and length of life. And when we see communities that have been starved from resources to help address those issues, when we see schools funded off of the property taxes in communities, what we see is the deliberate and intentional divestment of communities that really need equity. And a majority of those communities are communities of color, and we see it play out time and time again. So the desire would be to address it from that approach, really speaking to the public health issue and making sure that it's comprehensive. We like to solve problems in a very linear fashion. Unfortunately, this problem has grown so significantly that we cannot approach this in such a manner. we have to come at it comprehensive. We have to center communities, and we have to make sure that we are taking evidence and tailoring it to communities and not trying to stick this evidence-based Band-Aid model on a community that isn't necessarily ready for it. There are various ways we can create solutions, but we must recognize that these issues are health issues. We have to reconcile with the reality. We also have to be empathetic and compassionate. And unfortunately, as a state, we haven't been there, and we have suffered the results as indicated in a lot of our state outcomes.
We have suffered, and our regions have suffered, and we all, as citizens of the state of Missouri, are affected by this. And we now have a question from the audience. Savannah T asks, what can be done to truly bring the police and community leaders in line to work together to build up our most vulnerable? Arletha, would you like to take an opportunity to answer that? How can we work together? I'm sorry, Arletha, you're muted right now.
Sorry. Yeah, the way in which the police across this nation have handled communities of color is inappropriate. And Michael has already mentioned all of the things that indicate that, all the research that has gone into understanding that. The police boards, the policemen, the law enforcement agencies really have to make the decision that they are no longer going to allow bad actors within their ranks, no longer deem it to be okay to be afraid of people that they are sworn to serve, and to learn how to process their biases, because we all have them, but learn how to process those in healthy ways. And the community leaders, we must hold them accountable, and not only through who we elect as sheriff, and how we hold the police chief accountable, but the police board as well, and making sure that our voices are unified in an approach based off of the communities that we come from, and gathering people so that they too understand how they can affect how we are approached by the police. The community leaders have to hold the police commissioners, and even lawmakers accountable. Right now, here in Kansas City, there's a huge discussion of what we should do with our police here, and our police chief here. And there are many things that we could do, but if we don't unify and hold them accountable, not just when it's a situation, but on an ongoing and consistent basis as community and community leaders, we will continue down the path we've been on for over 20 years. And that is unacceptable. And we know better. So we have to hold them accountable to do better.
Yeah, accountability becomes a very important topic in this discussion. And I know we've got some conversations that's going on here that Jaden, you would like to comment. And I know, Michael, you probably have to leave soon. So we're going to go right to you first with Michael, then we're going to go to Jaden. So go ahead, Michael.
I think this question is a really important one. I think that there needs to be police reform in this country. We see how police officers use discernment just as recent as the Capitol. And so it's judgment. It's the lack of accountability. It is just the way police officers are trained to police communities of color specifically that makes this unjust, that makes this inhumane. And it's a problem. And so in order for us to move forward, the police departments across our state have to recognize that they are also a part of the communities that they're working in, that they are also either contributing to the problem or addressing solutions in a way where communities can thrive. And until we get to that point, we're never going to see the outcomes that we desire to see. And so we have to develop solutions that are empathetic, compassionate. We also have to figure out ways in which we can really divert a lot of the issues around mental health and substance use to healthcare professionals and social service professionals, so that we free up the capacity of law enforcement to be able to respond to high violence areas or crime. And there's just so much. There's so much to be done, and we aren't even scratching the tip of the iceberg, unfortunately, because of the lack of response from the state government. And we see it most recently in St. Louis. There was an attempt after a very violent year, as described at the top of the panel. But majority of those, or I shouldn't say majority, a lot of those have been babies, kids that are under the age of 15, and we cannot call a special session to address gun laws so that local municipalities can take control over that. It just doesn't make sense. And until we can do things that make sense and bring in all perspectives in a comprehensive way, we're going to continue to experience this, unfortunately, and it's going to get worse before it gets any better. And I hate to be the pessimist on the panel, but
no, I don't think you're being pessimistic at all. You're speaking to the reality and the challenge before us. Jaden, as an elected official, legislator in Jackson County, I'd like to give you an opportunity to bring you into the conversation. Go ahead.
Thank you, sir. I think what we face currently right now is that the state has a different ideology and a focus than many of our communities around the state. Even in the most rural parts of Jackson County, I was able to go to a local gun club and just have a discussion about the amount of violence that we are seeing, even in the majority white, but also wealthy neighborhoods and those different types of things. All around our communities, we're seeing such a rise in violence. And one of the failures is that local governments have, sadly, washed their hands of the issue. And I won't say completely, but they give opinions. And I think Mayor Lucas here in Kansas City has done one heck of a job in trying to bring the focus back to local governments. What we'll take is that, like myself, a legislator who represents the entirety of Jackson County, but also leaders in our city governments, talking with police, talking with organizers, trying to set up a way to have a discussion about not necessarily the response of what may have happened in a violent altercation, but what is the first step to solving the issue? For so long, this country has been, you either take the side of the police or you take the side of, in many cases, Black Lives Matter, but also just, or even not even saying anything at all. I think we have to recognize and respect those opinions, but also to realize at the end of the day, we're talking about people's lives. We're not talking about an idea of that, who do we respect more? We're not talking about the idea of how our political ideology falls. It's about taking care of our fellow citizens. I mean, that's what's interesting is that, especially from a Jackson County standpoint, Jackson County needs to be working with Kansas City, but also working with an area like Grain Valley that is in our rural-most part of our county. Having these discussions about how do we bring about police reform, how do we bring about fighting against violence, and also dealing with the mental health aspect. And if I can, Andreas, I just wanted to mention to the question before. Currently, Jackson County is having a discussion about building a jail. Right now, we have no discussions besides myself and another legislator about talking about mental health and about looking into those who have committed a crime, or talking about building mental health facilities around the county. Those are things that are a huge first step in the mindset of a local government, because the state will not partner with us on this. I mean, let me just be perfectly clear. That is not their focus, but it's going to take local governments acting on their own as best that they can, especially in the ways of mental health, especially in the ways of jobs, especially in the ways of how we protect our children. It's going to take local government to step up, because the state right now, sadly, that's not their focus. But we have to keep coming back to the focus of that. This is about our kids. This is about our next door neighbor. This is about our loved ones. We're trying to protect people's lives. And that's what I think is being so very much so missed in this discussion.
Right.
Not
Yeah,
today, but also
Go ahead.
mainly throughout the discussion in the last 10 to 15
Well,
years.
you raise a good point, and that is we often look for state leadership, or we come to elected officials to try to solve the challenges in front of us. And oftentimes we forget that grassroots mobilization and issues like that are just as important and tremendous value in impacting change in our communities. With that in mind, let's go into the next segment, which is about public health strategies and the law. So Kim Gardner, a St. Louis circuit attorney, said the current system enforcement and imprisonment does not lower gun violence. She states the following, and I quote, "If more arrests and more prosecutions equal safer cities, the city of St. Louis should be the safest city in America." But it isn't, because we're not dealing with the root causes of violent crime. So Dr. Jones, I'm going to go to you. Speak to the concerns of what that circuit attorney notes.
Absolutely. It seems like she's really trying to articulate much of what we're saying today, which is that we have taken a single approach or single punitive lens towards addressing violence. I believe that lies in the mindset that every decision lies inside of a person. Every single their circumstances have nothing to do with the conditions in which they've been reared, and the systems that have worked against them since before their birth have no impact. You know, the idea is that they are entirely and solely responsible for every negative decision that they make. And so I think I would agree with her that that is sort of where people are coming from, who say, let's just go with the jail idea. But obviously it is not working. Now I will say that from the public health aspect, our role has really been to help every single sector within the community, whether it's the business sector, the nonprofit organizations that set out to be helpful, the places where people show up to even get care, to say, hey, I want to tell you that I know you may mean well, but you are also contributing to this culture of violence. The way that you treat people when they show up, the way that they might receive the runaround when they come trying to get help that would stabilize their families. You can be contributing in ways that you don't realize to the problem. And so as a public health agency, our goal has really been to put forward strategies that everyone can adopt, everyone can see themselves inside of. You know, if you're not sure if the panel has heard of the Kansas City Blueprint for Violence Prevention, but it talks about every single sector. If you're a workplace, there are things that you can do to reduce the likelihood that the people you employ or their families will suffer violence. So I think it is really a very short-sighted and a very singular lens that people who advocate only this law enforcement approach are taking to the violence problem.
You know, it's interesting you mentioned that, because as a funder, I often engage with funders and they say, oh, we don't fund in violence prevention. We don't address the issues of homicide, et cetera, with our funding strategies. And I always say, but do you fund tutoring programs? Do you fund mentoring programs? Do you fund jobs? Do you fund housing? So if you're funding in those areas, you're funding in the area of preventing the kinds of crimes that we see happen in our communities. So with that in mind, I want to go back to Michael again. Let's talk a little bit about the criminal risk factors, or that culture of violence that Dr. Jones references, and connect it back to the social determinants of health.
Certainly, and Dr. Jones mentions so much. There's so much that could be expounded upon there. But really, when we look at criminal risk factors, and we look at what's being judged for criminal risks. Those are the same things as social determinants of health, education, employment, your social settings. Who are you closely related to? Your community, uh, education, your health behaviors. All of those are actually the same factors that they're evaluating when seeking to understand risk. And so when we look at really creating public health or just strategies and solutions to address the needs in communities, they are the same. They're one and the same. And so when we're talking with, for example, Circuit Attorney Gardner and other leaders here in the St. Louis region, we're conveying these issues. But then another component, the flip side of that coin, is actually policy and advocacy or political determinants of health, where voting, advocacy, and policy also contributes to these probably at a higher rate than just the programs or local policies that could be enforced to really help with this issue. One of my biggest concerns with the St. Louis region in particular is that we do have a lot of nonprofits, but nonprofits are designed to plug gaps where policy otherwise doesn't exist. And so if we're seeing an increased number of nonprofits addressing these issues, we have a failure at the state level. And so in order for us to correct this, we must be properly working together to advocate. We must properly work together to get people out to vote. And there's some incredible organizations doing that work. But then lastly, we have to hold policymakers accountable to representing us not only in their place or their community that they're coming from, but also to address the larger issues across the state. And so what we see is a nice, fine intersection between social determinants of health, political determinants of health, and criminal risk, which either exacerbates gun violence or it can nip it in the bud. And so there's a lot to really unpack there, but that is it in a nutshell.
Thank you. Thank you. We're going to move to a question from our audience. Savannah T asks, and speaking to just the very issues that all of you have already noted, what can be done to truly bring the police and community leaders in line to work together to build up our most vulnerable? So Arlita, I want to go with you. What are your thoughts on that? What can we do to address this issue of policing the community and addressing the most vulnerable?
Well, again, as has been so eloquently said by Dr. Jones and Michael and Jalen, we must really understand what the social determinants of health are. This is language that isn't at every level of advocacy, and making sure that as people are learning these determinants and understanding, they have an inherent understanding because they know they're sending their kids to school, but their ACT scores, even when they're straight A students, don't equal ACT scores in other communities where their education is different, even though they're in public education. So really bringing together the community leaders and the police, you know, as Michael said, being members of the community, seeing the youth as people just like their own youth, having resources. Our youth have nothing to do. There is nothing for our youth to go do. With all of that energy, all of that time, it really puts them at risk for bad behavior. Look at what happened to Independence Mall here in the Independence, Missouri area, where a large group of kids decided to go to the mall and behave poorly. And so we have to, as community leaders, come up with the resources. Nonprofits and other advocacy groups help fund those, have funders help fund those activities, police be a part of those activities, so that not just a few youth are impacted, but that all of our youth are able to find some place where they're welcomed, where they're taught, where they're celebrated, and where they can learn how to be good members in the community and see different sides of the community, not just the one in which the family in which they belong in, but the community, the block in which they belong in, the state in which they belong in, and are expected to be authentic citizens of their communities.
So getting to that authentic space, that social contract that we often were taught in our sociology and American history classes. Let's speak to that authentic place and speak to the reality of what we have right now. And we're going to do that through this question that just came in from Virginia R. She says, what stakeholder groups external to firearm control could be engaged in this work? And so what are facilitators and challenges to their involvement?
I don't mind jumping into this.
I'm just going to open it up to anyone. Okay, go ahead, Michael.
I think everyone is a stakeholder in this. I think when we see our region, our state suffer from gun violence, that's in return is a consequence to our economic fabric and our economic viability. So everyone's a stakeholder. And so we have to engage everybody. We saw from 2012 to 2014-ish that gun-related injuries that resulted in a inpatient or emergency room visit cost roughly about $42 million. And when we look at the costs of funding our local safety net in the St. Louis region, all the organizations that provide resources for the most underserved communities, that's half of that. And so what we have to do is make sure that we are addressing or engaging all stakeholders, making sure that community has a voice at the table, the youth have a voice at the table. We're diminishing power dynamics. We can explore solutions in a compassionate way where we are not judgmental, where we can really uncover biases and blind spots that show up in these systems, because the fact of the matter, at the root of all of this is really systemic racism and a manifestation of capitalism and an intersection of the two. And so what we have to do is be diligent there in making sure that we are not leaving a stone unturned. And what is at the root of this question, going back to political determinants of health, is advocacy and making sure that we engage everyone. The perfect example of that is Medicaid Expansion. And I'm so honored and privileged to work on that campaign, where we saw groups all throughout the state advocating for healthcare for communities, saving rural health centers. And we had endorsements from the Archdiocese of Missouri and Planned Parenthood. Where would you ever see those two coming together on an issue? And so we have to engage people. We have to let them understand the civility around this and just urge people to have some semblance of humanity to really stop people from dying. If nobody has ever saw somebody die from a gun, then I think you are really, really underestimating the magnitude that this trauma brings to community, the impact that this has, and it just has to start with engaging everybody.
And trying to find that common ground in a society of polarization. So we have community advocates, we have an elected official. Let's speak to the next segment of our discussion, and that is public health funding and its impact of the social determinants of health. Missouri ranked 6th to last in the nation for public health system funding, and 46th for state funding of higher education. When Governor Mike Parsons recently announced a $209 million new in-budget cuts last year, 131 million comes from K through 12 schools. You keep referencing public policy, cutting public education. Where does that leave us? Michael, I want to go back to you, and I want to open it up to Jaden.
Yeah, and I just want to first say I am so grateful and honored to be a part of the panel. I am going to have to leave. My flight is boarding now. But to answer that question, when we do not invest in our future, when we do not invest in our children, we see this, and we see children dying from gun violence at younger ages. We see children having access to guns at earlier ages. And when we do not educate them, we do not help them understand the magnitude of a weapon, the magnitude of decisions, then there are consequences to that. And we have to invest in our children. We have to figure out how to do this because it's disheartening when we see ourselves on the bottom half of every horrible statistic. In the St. Louis region, we've seen an exponential decrease in public health and human service funding since about 2000, but an exponential increase in funding for public safety. Yet we haven't seen any changes in the violent crime outcomes. And while Circuit Attorney Garner and others, grassroots organizations, all the stakeholders that have been mentioned throughout are doing all that they can, ultimately it comes down to funding at a state level, political willingness to support efforts like our representative has stated around mental health and behavioral health. And there has to be a lot more intentionality. But when we see stakeholder groups invest billions into lobbying against these efforts, it makes it really difficult because a community doesn't have billions to spend on upholding policies that marginalize them. So there's a lot of work to be done, and I'm very excited about people like those on this panel really helping to address the issues.
Michael, thank you for your perspective, bringing us a viewpoint from across the state of Missouri and St. Louis. Have a safe flight. Jaden, you're an elected official. Finite resources, budget cuts. Everybody has something that they want to preserve. We can't fund everything. What's your solution as a state legislature as it relates to this question?
Well, let me first say I wish I did have influence on the state, but again, focused on county government itself. And also, before I get too deep into this, I do want to mention that Dr. Jones, serving on our Kansas City School Board, is at the forefront, of course, of knowing the extent of the cuts that have been done by the state. I think what's so clear is that what we must realize is we have allowed this governor and we have allowed this state legislature to put in place tax breaks for the top 1% who, it's amazing, the top 1% in this state received more of a tax break than those who make less than $200,000. What we also saw is a tax break to businesses that claim to be in Missouri, but the majority of those top 1% of businesses have less than 100 people hired within the state of Missouri. We're sacrificing children's lives. We're sacrificing public health. We're sacrificing the protection of all of our communities for a political ideology to get the backing of very powerful people. These are powerful people with a lot of money, and they want to, they'll always say, we're trying to bring business here. If we have more businesses in the state and more jobs, there won't be so much violence. The fact of the matter is we haven't seen that. We've seen less jobs come to this state, less jobs that can go to people who necessarily don't have a bachelor's degree or even an associate's degree. We have to, as a local elected official, which I've discussed with my colleagues and also with my fellow elected officials in the cities, we have to press against this idea because here in Jackson County, we have not seen any type of of dedication to new jobs. But in Kansas City, you see the principals and teachers that I've been going, especially at East High School and Northeast and Central High Schools, they're barely making it. They're trying to get by with whatever they have. And that's not the fault of the school district. That's not the fault of the superintendent. That's because the state has tied both their hands behind their back and said, okay, fix the problem. That's not how any type of government should be handled in any way, shape, or form. And of course, I'd love to hear Dr. Jones's response to what I said, but also to this question, because until we understand where the money is actually going and why we face such critical moments currently, we're just be yelling into the wind. We have to make it perfectly clear what we actually face.
Thank you. Thank you. Let's go to Dr. Jones. I know you want to reflect on this question, and because in the end, we're talking about young people and the elimination of funding for education. At the same time, I want you to think about funding and how it's just impacted the prevention work needed by the city.
Absolutely. And this question, really ties into what the previous question about who are the stakeholders, one of your audience members' questions. And, this issue, these issues are so intertwined, as Jalen kind of articulated, the issue of prevention funding, but as well as education funding. Good investment in the education system is prevention funding.
Yes.
And so when you're not seeing that, it's almost a signal that you can expect public health outcomes not to improve. Having access to quality teachers who are able to be retained, teachers who will feel supported and have the resources that they need to give children a fighting chance. That is prevention. That prevents those children from decrease the likelihood they'll be suspended, decrease the likelihood that they will drop out of school. We know that children who have dropped out or are on the cusp of dropping out are more at risk for being a perpetrator or a victim of violence. And so I just want to reiterate, the education system, teachers, administrators are all stakeholders and all a part of that prevention infrastructure. But even when we talk more explicitly about prevention funding, part of the funding that goes to people who are victims of violence, so people who have been assaulted or they have lost a family member to violence, should be entitled to funds that will help them go to counseling and get therapy and rehabilitate their home if need be, or relocate or what have you. We have consistently seen funding short in that area. And so what you have is a lot of impacted families who deal with all of that trauma on their own without support. And so that's just one aspect of that. And then supporting vulnerable families. So going back to another, kind of equation, funding for social supports or human service supports, the family health and human services, that equals prevention funding. So if there's a family that's on the edge and maybe a parent has a substance abuse problem or their finances are so unstable that their child is at risk of entering the foster system, being able to have supports that help that family get back on track and support that child so that even if they do have to go to foster care, they will be supported in that system. What we are seeing is a huge problem with children who are interacting with the foster system and in many cases aging out of the foster system, and they have not had any sort of support, any sort of counseling or extra support to make sure they're on track with their education. And so these are all of these factors and all of these different arms of human services funding is impacting this topic of today, which is gun violence. And so they're just so connected, and all of those systems have seen cuts in this state.
So, Dr. Jones, I want to keep you on topic here as it relates to the next question, and it's all about, we're talking about violence and how most people equate violence in Missouri as an urban problem. Mm-hmm. Parts of Missouri, though, whether we're talking about rural or suburban, and we're seeing more and more the poverty isn't concentrated in Missouri; it's scattered throughout the state. And with poverty, you have low levels of education graduation rates. So we are seeing gun deaths in those rural communities as well. So how do we get people to care? And with that in mind, just speak to the work that you're seeing as it relates to these communities and the public health funding.
Absolutely. And it's very unfortunate, but almost sort of has a sort of a poetic ring to it, in that some of the very same ideologies that have left sort of what we see in the urban core abandoned and written off, those same ideologies are harming our rural counterparts, in my opinion, in that if you believe that it's all about the individual, you alone control your destiny, nothing, no conditions or anything put you at risk, so then you adopt a mindset, I don't have to address risk factors. I don't have to increase protective factors or work on reducing the risk factors. And I think that is what we are seeing with our rural partners. I think that we would all, both rural and urban or locales, will be more successful if we came together and said, look, we share these risk factors. We share low graduation rates. We share low or high numbers of unemployment. We share substance abuse concerns. But I think that the artificial differences in ideologies keep us apart. And we are both suffering, both types of locales are suffering through that.
And that suffering has to come to an end, needless to say. I want to go back to Arletha with the question, because you come from the perspective of this having impacted you personally and your family. The young man in question that killed your nephew, what factors do you think could have changed his trajectory in life?
Honestly, just everything that each of the panelists have said. Not to be redundant, but this young man apparently didn't get and was subject to all these risk factors. I think that him having even the ways in which his life choices impacted him, and not getting that support, as Dr. Jones said, where he may have been able to be redirected in some kind of way. Maybe he's a person that likes to work with his hands. Maybe he's a person that's an artist. Maybe he has substance abuse issues. Maybe he has behavioral issues. Maybe he has mental health issues. Was he given all the redirective tools and the support so that he would make different choices? And those are the things that we, as they've said so eloquently, we see over and over again. The society in which haven't been touched say, well, it's not my problem. My children are going to school. My neighborhood is really nice, or, my family doesn't have those encounters, where neither did mine. Been in the community all my life.
In mind, I'm going to open it up to the group. Missouri lawmakers, are you hearing any specific projects, works that they're working on to address this very issue, whether we're talking at the state or national level?
Well, I'll do my best here.
And we might even speak to anything as it relates to gun control, as far as
sure,
which is often a very difficult topic.
Yes, very much so. It's sad to say that the focus of the General Assembly here in the state of Missouri is not focused on that. Now, there are many who are doing their best to get legislation passed. For instance, the fantastic elected official, and also my dear friend, and also Miss Arletha's daughter, State Representative Ashley Bland Manlove, has proposed several bills and suggested several ideas on how to tackle gun violence, how to end that stain on our society, how to bring about the idea of more of a community-focused approach instead of just a widespread government stamp to solve all these problems. The fact is that that's not the majority thought. And those bills, those ideas never get a chance to go to the committees where they can first be worked out and had to have a breakdown of how those things should work. And they never get see the light of day. That's the problem that faces Missouri. That's why we face the things that we are facing now, is because there is not a willingness to even have a conversation about any of the things that we face in gun violence. On the federal level, I do know that I know Senator Manchin from West Virginia and Senator Toomey from I believe it's Pennsylvania has been working on a background check bill, which would be a very, very beginning first step in that whole discussion. But I do hope that, while the federal government is focused on COVID, that we do get back to a point to say, what about mental health? What about the discussion of violence in our country? How do we move past this idea of us versus them? And I will say from a local standpoint, if I could just very quickly, Andreas, is that we have to work with our prosecutors. Gene Peters Baker, who's a prosecutor here in Jackson County, started a program to check up on victims of gun violence. But also she has talked about checking up on the families of the individual that has caused that violence and the individual who has caused that violence. It needs funding here locally. We need to fund programs that will help in the mental health side of things, in getting jobs, and making sure that these people realize that their government does care about them. That's one of the biggest things that we face, is that we cannot allow this idea that, well, if only we were morally more focused, if only we had, you've been raised correctly, as Miss Arletha pointed out. Even in my family, I have lost nephews, I've lost nieces, I have lost close friends to gun violence. This is not just something that affects a certain amount of people. And the day that we as a society, and mainly a government, can get past that, that's when we can actually face our problems.
Thank you. Thank you. Arletha, I know you had a closing comment as relates to this topic. We're coming close to the end. I do have one final question, but please, Arletha.
Oh, I was just going to add to just what Jalen ended up speaking to. This year, Governor Parsons increased the budget for the correctional facilities while decreasing within that budget rehabilitation of services. So, that is a direct failure to the young man accused and to his family. And, it's a horrible juxtaposition for people to be in who want to see a healthier society, and it being completely ignored by our legislators and our governor is unacceptable.
Thank you. You all provided tremendous insight into this topic, and we can go on all day. So many different subject matters have been touched upon. But I want you to think, as we move here closer to the end, we want to spend our last few seconds discussing the immediate steps that can be taken to address gun violence as a public health issue. As is tradition with all of our American Public Square at Jewel programs, we want to give each of our panelists the opportunity to answer the following questions. So what? And now what? Jaden, I'm going to begin with you. So what?
So what? And now what?
Yeah.
What a fascinating, as I've been to these many times before, I've never been able to answer these myself. So what? The so what aspect of is that are you a human being? Do you have someone that you love, or several people that you love? Do you care about your community? Do you care about the well-being of others? but also do you respect an individual discussions and individual debate that is respectful? Are you willing to listen? That the so what about this is that this affects you, whoever you are, throughout this entire country, in the United States. This affects you. The so what aspect is something we cannot afford to ever just say and walk away. The fact is that this country, when we had the horrible, just mass murders and killing of children that we saw in Connecticut, and killings that we saw in Florida and across this country, when the United States decided not to do anything in those instances, that's when we said we don't care about our children's lives. Not even talking about the horrible acts that have been done, even with people just going out to a country concert in Las Vegas.
Okay.
I mean, when we can't even
we're coming to the end, and I want to give the other two an opportunity to respond to the question of so what and now what. Arletha, you got to unmute.
We are not able to say so what, because every aspect of our lives are somehow connected, whether it's through who your children get to go to school with, who you are, who are their friends, and what are their friends going through with that impacts your child. What about all of the ways in which we intersect in our communities, at the grocery stores and in the malls, and our safety in all of those spaces. So we can't say, so what? It doesn't affect me, because it does. It's, do you recognize that effect, and do you shrug it off because it hasn't harmed you or yours or those you love in a way that you feel it impacts all of us? And now what? Well, now what? We really must engage in doing the work of getting all the stakeholders to the table. And all of us can do that, checking on our teachers, helping our teachers who are doing their very best to educate our students, making sure our students are prepared when they go to school, prepared when they're virtually learning and have the spaces they need. And then reaching out when you don't have those connectivities and when you don't have that support, reaching out. We must act. We can no longer sit back and go, not me, or not me this time. Yeah. We have to act.
We always think somebody else is going to solve it for us. Dr. Jones, your response to so what, now what?
Absolutely. So all of us have to do our role to address violence. And if we want to prevent gun violence that we're talking about today, we can't support violence in any of its forms. And we have to all speak out against that in all of our spheres. So we can't support denying access to equal education or family supports or access to any of those things. If we want to address gun violence, we have to speak out against all of those.
Thank you. Thank you to our panelists. We are at the end of the program. This has been a lively and insightful discussion for all of us, and I hope those of you listening have enjoyed, and some point not just enjoyed, but have been upset about what you heard. I'd like for you to thank each of our panelists for helping us to frame violence as a public health issue. In addition, I'd like to thank American Public Square at Jewel and the Kansas City Star for facilitating this important discussion and allowing me to serve as today's moderator. Discussions like these help the Health Forward Foundation as we work to transform communities so everyone has an opportunity for better health. I would also like to thank Report for America and the Missouri Foundation for Health for supporting these important efforts. The Kansas City Star will continue to investigate the causes, consequences, and possible solutions to gun violence problem in Missouri. If you want to support the Star's in-depth reporting and solutions-focused community engagement efforts, please visit kansascity.com/MissouriGuns. Finally, if you've enjoyed this program and believe that conversations like this are important, please consider becoming a member of American Public Square. APS members help support programs and allows the organization to continue providing a space for civil, fact-based discussion. You can learn more about membership and its benefits by visiting AmericanPublicSquare.org. Thank you to everyone who joined us today, our incredible panelists that shared their insight, their personal stories, and for those of you that provided questions. This conversation will continue in the coming months, and we hope you learn from this conversation and feel more empowered to engage in your community as a result. As the question was asked, so what? Now what? That's in front of you. Have a great afternoon, and thank you for this discussion.